My name is Rodrigo Miguel Perez Maceda, and I'm in family medicine at Prisma Health. I'm from Greenwood, South Carolina, and my parents both work for Self Regional, and I've really been around medicine for majority of my life growing up. I have a lot of aunts and uncles that are also in medicine. For me, I've always been focused on the sciences, and eventually went to pre-med at Wofford as a bio major, and actually ironically a theater minor. And because funny enough, I could either be a real doctor or play a doctor on TV. Scrubs is actually my favorite show. And then after Wofford for pre-med, I went to med school here in Columbia, South Carolina for med school. And after I finished my med school training, I ended up actually moving to Georgia. I used to live in Albany, Georgia. That's where I did my residency at the Phoebe Hospital System. And then after I finished my family medicine residency, I used fellowship training to come back to Columbia, South Carolina, and came back to Prisma for fellowship training in palliative medicine. So end-of-life care, comfort, hospice, kind of a lot of those discussions with end of life. So family medicine to me is more in the sense that what general people think of as a doctor, like a general practitioner, their family doc, the doctor that has seen them throughout the years consistently, and is in a sense their doctor they go to that they trust and can provide them guidance with their health. Family medicine is like first line defense before we kind of delve into more specialized organ systems. I look at the broad picture and see how your different chronic conditions can kind of compound on each other. Everyone has responsibility for their own health, and at some point for me, I had to also take care of myself too. So I understand where people come from when it comes to worrying about their blood pressure or their cholesterol or their weight, but sometimes you just need that secondary hand that kind of helps guide you along, or just helps you hold accountability for your actions. So one of the things that I think is important, especially we're working on weight, I'll come up with a plan with my patients that's more tailored to what they can physically do. People say diet and exercise, but then you're like, how do I start? Because I personally work on that stuff myself, and these are things that I do that have worked, will at least give you a base, and then from there I provide you with the basic start. Then it's really the world is your oyster. You can kind of go the route you want that is tailored towards you. When I'm outside of work, I'm either really actually working out, and one of the sports I do now still consistently play, because I used to play a lot of football, soccer, basketball and stuff in high school and college, but now the easiest thing I can do is probably play racquetball. Racquetball is very intense, very fast-paced, good workout too. And then I cook a lot more now. Actually, since I've been healthier myself, I honestly look up a lot of recipes online, figure out either how to make it healthier or just make it taste better. I'm a big gamer, actually, and also watch a lot of anime and Marvel and any of that stuff. To make an appointment with me, please call the number on the screen.